Well, June is Men's Health Month, and this morning we're taking a look at the #1 killer when it comes to men's health, and that is heart disease. Dr. Kohli is here with more insight into this important discussion. Good morning, Dr. Kohli. It's good to see you.
I'm so glad we're having this conversation.
I know. Well, men are, at least in my family, they're so hard when it comes to go to the doctor, right? My dad, my brothers, they just don't like to. But what would you say to men in our community right now during this month?
I would say a few things. First, we know that men on average are likely to die 5 years earlier than women, and they die of many of the causes that are preventable. In fact, the American Heart Association tells us that 80% of heart attacks and strokes are preventable with the right interventions. And I would say to them, it's not just the men in your family, but men in every family, that there is a stigma around men seeking help.
Yeah.
There is a perception that it creates weakness, that it's a sign of not being macho, that it's something they should just tough out.
Yeah.
And a lot of men actually would rather not face the truth. They would rather be in denial than face the truth. So that is a culture we really need to shift on it.
And so you see that as a doctor, right? That they'd rather avoid the truth. It is so true. Why do so many men delay getting that medical help, like in your professional opinion?
So I think part of it, like I said, is cultural, because as adolescents, they're taught to be sort of tough, just put some dirt on it and move on.
Yeah.
Part of it is also they're not plugged into the healthcare system like women are. So if you think about women, they tend to see their gynecologist regularly. So they have a point of contact, a physician who they usually see, even if they don't have a primary care doctor. Whereas with a lot of men, they don't really have someone that they go to for regular checkups. So they're not really plugged into the system as well. And mental health is actually a worse problem in men because they suffer silently. So a lot of them that do have fears or concerns or even mental health issues like depression and anxiety, they don't first recognize it, and second, if they do recognize it, know how to seek help for it.
Oh, and see, that's so sad that they just rather just go through life with it without doing anything about it. How can we encourage men in our lives to really take charge of their health?
So I think we have to do two things. The first is we have to normalize and sort of even make trendy healthcare. So we have to make it so that the men in our lives, and I want you to do this to all the men in your lives, because Father's Day just happened, go to the doctor and seek regular healthcare as part of their sort of maintenance and prevention. The second is, I think, really leveraging family and saying, do it for your partner, do it for your kids, do it for your parents, do it for someone else, so that the men feel like, even if they're not motivated to take care of themselves, it's about being around for somebody else that they love.
Okay, all good advice. Now, what screening tests should men, especially those 65 and older, be getting? This is kind of a big question.
It is. So I would say in kind of the less than 40 age group, you want to really focus on metabolic risk, which is your cholesterol, your weight, whether you're getting enough exercise, getting enough sleep. Also think about testicular cancer screening, because that has a peak in the younger men. When you get to the sort of 40 to 60, you want to think about colon cancer with colonoscopies, prostate cancer with a blood test called a PSA, and that's when you start to think about cholesterol and heart health, because you're becoming middle-aged.
Yeah.
And then after 60, we really, of course, think about cancer, but we think about blood vessels, we think about kidney health, we think about liver health, we think about heart disease screening much more aggressive.
Much more, yes. Now talk about the younger men, because you touched on it a little bit, but we're seeing more and more bad news for younger men.
We are. So cancer is becoming a disease of younger people now overall. So I would encourage the younger men, the healthy men, these are your teens, your 20-year-old college students, to do testicular self-exams every month, just like women do breast exams. And it's really, you want to do it right after the shower, and you want to really palpate or feel the testicles to make sure there's no mass, there's no tenderness, there's no pain, there's no change in size. This is really important because testicular cancer often doesn't have symptoms besides just a mass. And so men really have to check themselves in order to diagnose it.
Yeah, they do. And so it's similar to when women do the self-breast exams. Just feel for any kind of change, any kind of lump or difference in size. Okay, good advice there. Now, to heart disease, which is the #1 killer of men here in the United States. Why should they take control of that heart health? What's a good way to start?
A good way to start is to know your numbers and know your risk, because if you know those numbers, you can actually change that risk. So I like to say it's like a train going on a track. You make a small little change in the track, the train is going to end up a whole different destination 10, 20, 40 years later. So I really want men to feel empowered by knowing what their cholesterol is, knowing what their blood sugar is, knowing their blood pressure, knowing knowing their waist circumference, knowing a blood test called a lipoprotein A, which is a genetic marker of risk, because that doesn't just affect you, it affects your family members. And then if you're over the age of 40, you get a x-ray of the heart called a calcium score, and check a simple urine test called a urine microalbumin. So blood, urine, x-ray, you will know exactly what your heart health is and exactly what you can do to change it.
That's so important, and it could be that simple. Thank you so much, Dr. Kohli, for shedding some light this morning on men's health, especially as June is Men's Health. And if you have any questions for Dr. Kohli, send us an email, that is, to mycoco@9news.com, and put Kohli in the subject line. We're back with